Hello, and welcome to Dr. B Talks About Audiograms, where I try to answer that question, what does my hearing test mean? I'm John Burgoyne. I'm a practicing otolaryngologist in Austin, Texas, with over 30 years experience dealing with ear, nose, and throat patients and their problems. And if you ever had a hearing test and been given a big messy piece of paper and wondered what does all this stuff mean, I'm here for you. So let's look at an audiogram. Here's an audiogram. To be honest, it's an audiogram from me from a while back when I was having a hearing problem. And it has several different areas that we need to talk about. We're going to talk about this part, which is the main hearing test, and we'll talk about that. This part, which it goes on with these parts, which talks about how well your eardrum's moving and working. We've got this part that has some information about the average hearing that comes from the hearing test, and this part down here, which deals with how well you're able to understand speech. Now, before we talk about the different parts, let's look at the ear for just a minute. So the ear, we have sound, it comes in through the ear, that vibrates the eardrum, makes these little bones move, that vibrates the fluid that's in this thing that looks like a snail shell, which is called a cochlea. That then goes along the nerve here and into the brain. So the first thing that we're going to do is we're going to look at that main graph here. This is me in 1985. My hearing was better back then. So on every hearing test, there is going to be a red set of circles, and red and round is right. We're simple-minded people. We try to keep it simple. And there's going to be a set of X's with either black or blue joining them together. And that's going to be the left. The reason we do circles and X's as well as colors is in case you take a black and white copy of this, it'll still make sense. There's always a little key to the side somewhere. But basically what happens here is they put the earphones on, and they make sounds at these different frequencies. 125, that's real low. And 8,000 is just about as high as most people who are over 30 can hear. And the zero line, it's not no sound, it's perfect hearing. So if you test a bunch of 15-year-olds, their hearing averages out to be around there. Just like with some people who can see better than 20/20, there are some people who can hear better than zero. And then everything louder than that is how much louder the tone had to be at that frequency to be heard. It's considered normal to be anything better than 25 decibels. So this is a very normal hearing test for a 25-year-old me. Here's another hearing test. This is a 61-year-old me. Again, the right side, all the round red circles are above 25 decibels, so that's normal. But in this audiogram, these and these are below normal. So when this was taken, I had a significant hearing loss in the low tones as well as in the high tones. And the other thing that you can see on this is it's got these funny little things. If there is a hearing loss, in addition to putting on headphones and bringing the sound through the air, we put a vibrator on, and that gives us some different information. So because I had a hearing loss, the audiologist also checked my left ear with the vibrator, and they got mostly the same answers. Okay, so what does that actually tell us? Well, here's the deal. When we bring sound in and it vibrates these little bones and it gets to here, all of that is just transmitting the air vibrations into the inner ear. Everything from here on is taking those vibrations, analyzing them, and sending them to the brain. Now, if I put a vibrator on here and vibrate the bone, it's going to shake this thing directly. So doing it through air and doing it through bone separates hearing losses to this area or this area. So when we saw that I had a hearing loss that was the same on the bone as it was in the air, that let me know that the problem was somewhere from here on in. We call these conductive losses, we call these sensory neural losses, but it's just a way to tell what part of the ear is malfunctioning. And in my case, it was the inner ear that was malfunctioning. This is a different hearing test for me when I had a different problem one day. At this point, my right ear was having a little bit of a problem, and this time the bone conduction was significantly different than the air conduction, which let me know that I was having a hearing loss in the part of the hearing system that includes the outer ear, the eardrum, and the middle ear. All right, so that was this part. That's what this part tells us. Next part we're going to talk about is this part. This is called emittance, but usually called a tympanogram. So what we do here is we make a seal and we put pressure against the eardrum to see how easily it moves. And normally it moves very easily as you cross no pressure differences. And these are very normal looking tympanograms. And that's the picture is where you can see it most easily. There are some other numbers in here. They measures the volume of the ear canal. They let us know that there's not a hole in the eardrum or something. They call it type A, but that just tells us the shape it is. But this is really something to look at to know that your eardrum's set up so that at the normal pressure in the air, it's getting its best vibration. So that's just the vibration right here that's measuring. Okay, so here are a couple of those. This is the one I just showed you. Normal, nice peak. They put a little gray box in here to help us know where normal is. But on this one, oh, something's different here. What's different? Well, first of all, the eardrum doesn't move very well at all. It kind of jiggles a little bit, but it doesn't move very well at all. And the volume here is 12.04 milliliters, which is lots more than it had been on a different day and lots more than the other ear. So what this tells us is the eardrum wasn't moving, and the reason was because there was a hole in it. So you put pressure on it and just nothing happens because there's a hole and that lets the pressure go in and out. So that's what the tympanogram is trying to tell us. So again, when we looked at that, this conductive loss combined with this and big volume says, oh, there must be a hole in that eardrum. Okay, so here we are. We're back to our whole hearing test again. We've talked about this part. We've talked about this part. Now we're going to talk about this part down here. This part is what we call the speech part of it. This is the part where they say words and have you repeat them and raise your hand if you can hear them. So this just tells us how loud it had to be to hear speech. And then once you know that you can hear it at some level, 10 decibels in this case, 20 decibels in that, they made it loud enough so you can hear it easily. Here they turned it up to 50 and 65 decibels so you can hear easily. And then I got all the words right on the right side. On the left side, I only got 88% right. So that was not quite as perfect as we'd like it to be. All right, so that goes down here. Then that's really all that you need to know to understand a hearing test. You need to know what the main graph shows, which is the hearing level, both regular with an earphone and if there is a hearing loss with the vibrator. You need to know how much the eardrum moves with normal pressure changes, and that's this part and this part. You need to know how many words they got right. This piece is just a little, I never looked at this piece. They take the average of a bunch of these hearing losses, and that's useful for, I'm not even sure what. It just says, oh look, he got, his average hearing level in the right ear was 8 and in the left ear was 16, but it's not important. This is also a part that's not important in most hearing tests. It is to do a different thing that you'll probably not see, and there's always someplace there's a legend. So that's it. Not as mysterious as you might have thought. Hopefully this has been able to help you understand better what a hearing test is, what an audiogram is, and will be a little bit less mysterious for you. Remember, Dr. B Talks About is presented for information and entertainment purposes. It is not designed to diagnose or treat any medical condition. If you have concerns about your health, make sure and see a doctor. That can be me if you're in Austin. Just Google me, you'll find me, and you can come see me. But make sure and see a doctor. Online forums, YouTube videos, including mine, do not constitute the practice of medicine. You'd think I wouldn't need to say this, but I do. This is not the practice of medicine. Please feel free to come and see me. And even more important, make sure and hit the like button, share, subscribe, tell your friends. Check out our other offerings on Dr. B Talks About. Thank you.